Hi, everyone, and thank you for tuning into episode 10 of the Real Heroes Don't Wear Capes podcast. I'm Stephanie Carter here with Michael Leans from the HSHSA team. Today, we're joined by special guests Latoya, Siobhan, and Becky from the Hidradenitis Me team. If you guys could please introduce yourselves to the audience.
Hi, I'm Latoya. I'm the founder of Hidradenitis Me. I'm the founder.
I'm Siobhan. I've had a HS for a little over 15 years now, since I was in my late teens, and I've been with Hidradenitis Me for about 2 years now.
Hi, my name is Becky. I've had HS for about 11 years now, and I've been with Hidradenitis Me as their secretary since 2020, just recently after I was diagnosed.
All right, so Hidradenitis Me is a support group that focuses on self-care, and we just want to connect with other warriors because we know that we're not the only ones there. And so, yeah, we were able to connect with HS heroes, as they mentioned. And it's nice to connect with other warriors and learn more about HS.
Nice. Thank you. So today we came together to do a recap on the Symposium for Hidradenitis Suppurativa Advances from a patient perspective. I just want to remind everyone that what is said today does not constitute as medical advice or accurate medical information and is purely our understanding of the information that was presented during the symposium. So I guess let's just dive in. So this year's symposium was hosted in Miami. And I guess just before we even talk about information, how did you guys all handle the heat in Miami? Because I felt like I was dying the entire time.
Yeah, it was hot.
That's the first time I've met tropical heat, and I don't really look forward to ever meeting it again.
No, I mean, it was almost similar to just like our very hottest days in Ontario. We're very humid climate, but day in, day out, even the nighttime, there was no reprieve from the humidity and the heat.
No. Yeah. Like it would be what, early to mid 30s in the day and then high 20s at night to early 30s. It would.
And there wasn't even like a nice breeze that would flow through or anything like that. It was just humid. Oh boy.
I think the big container ships may have blocked the breeze.
And just think, our Uber driver had said that it was actually cooler than what it's used to. And thankfully it was kind of overcast and rainy, because the last day when we were catching our cab, I thought, oh boy, I'm gonna get sunburnt in seconds and dying in the cab.
Becky got a sunburn in the overcast weather.
I did, because I was chilling by the pool for a bit.
Yeah, self-care 101. Yeah, no, it was really hot. For me, I'm always cold, so like the little bit of heat was good, but then like the days when it was dark and gloomy because it was raining, I'm like, how is it raining and dark and gloomy and it's hot, humid, like really humid? So that's the part that I found that was tough. But yeah.
Luckily, we were indoors most of the time, so it was nice and cool inside.
The AC worked well.
Yes.
So I guess to talk about the symposium, do you guys have a presentation that stood out to you as being the most interesting, or maybe what you thought would make the patients in our communities would find most interesting?
For me, that I found most interested in, well, really why I really want to go and hear the voices for, is just the mental health piece of it, you know, because you hear talks looming about HS and the suicide rate, but I don't really, to be honest, I don't really pay attention to it, but I did hear about it, and I was curious as to what the research would say. But then actually sitting there and listening to the presentation that HS has a high number of suicidal rate, and it kind of hits you. Like, I think about all of us who have HS, and we found each other and we're still standing. And I'm sure all of us had that thought about, like, I don't want to be here no more, especially because the pain does that to you. So I was very grateful that I was still able to get through my journey and be able to speak about it, because some people didn't have that opportunity because they couldn't bear the pain or maybe felt like they're really alone. So the mental health aspect of it, and hearing the doctor, I don't remember her name, but the social worker, and she spoke about like how doctors can kind of help the patients who do come in to see them, like make them feel validated, hear them out. Like she just gave them a kind of like a step-by-step on how to introduce or just how to deal with in that and in their appointments, the emotional side of it, right? And then encouraging to do a referral to social work or psychiatrist, because you can't basically have HS without going through anxiety and depression. Unfortunately, it goes hand in hand, right? So the fact that they brought that up, that really stood out to me, because I kind of feel like, did we get all the medical stuff? And then we don't really talk about the emotional stuff, right? So I think if we had HS and didn't have the severity of the pain that we did, the mental health wouldn't be so bad. Because I believe strongly from my experience that pain makes your mental health worse. So
I think
medical trauma.
I think some of the numbers I remember from that presentation was 24% of patients under 50 had, suicide ideology is the term that they were using. That's a really high number. And they accounted, when they were looking at this number, for people with pre-existing, mental health disorders or conditions. So that's on top of people who are already, clinically depressed and have, mental health conditions. I had, this is just a personal thing. Last time I went into my derm clinic, I had asked for mental health support because I feel like I've been through a lot of medical trauma. And I was kind of ready to start, dealing with it a decade later. But they just didn't have any resources available. And I was instead referred back to my family physician to try to get those, when I felt like it was directly related to HS, but they don't exist in that, scenario. You have to go through your family doctor.
I think in one of the presentations on pain and HS, I like that they said that they want to refer people to a pain clinic, but they also said that if required, also refer them to a mental health professional as well. So it kind of sucks that they put in that if required part, because I think it should just be automatic. Like if you're gonna, because it goes, like you said, it kind of just goes with the HS, even though they might not think it does, it does. So
yeah, they talked about mental health screening as well in appointments. So it would be they screen for comorbidities, they screen for mental health. That kind of should all exist within each appointment.
Yeah, I think they're getting there, and they're realizing that it's kind of required.
I think they're really kind of, it wasn't just presentations on clinical things. It was a lot of quality of life information as well, and really looking at what patients need in terms of, having a healthy quality of life, happy quality of life, not just let's manage the disease. It's let's treat the patient as a whole.
Absolutely. And that's one thing that I love about it. But, to sit there and see that there's more doctors, we only know our doctors, right, that we go to, but to see so much doctors from all over the world come together, and in that very space, nobody asks, what is HS? Because everybody knows about it. So can you imagine all those people? And then think of all those people in your hometown that know about it. That is amazing. So yeah, talking about research and the quality of life, and maybe things that we could look into or ask questions, and even the mental health piece. Yeah, it's good. It's really, really good. The difference between the last couple of years to this year, I feel like the SHSA you see progress each year, right? And it's so amazing. It's like the study is not stagnant. Mm-hmm. And to meet the residents, they're so eager, they're so ready, and they have all these ideas, and it's so nice to see them have such passion to want to manage the HS. And I even had a resident come to me and he's like, yeah, we're going to keep pushing till we cure it. And I was like, I love the energy, right?
I wish like, I think it's, you know, nice that we're doing the recap and you just said what you just said, because patients just, they don't see it. They don't see the research on a regular basis. It feels sometimes like nothing is being done, but there's so much. Doctors, these doctors care so much and they dedicate so much of their lives and time. And then you go to, you know, an event like the Symposium for Hidradenitis Suppurativa Advances, and it is just an abundance of information that's coming out every year.
Like I was thinking, like there's so many studies, like there's so many presentations on all these different studies that they're doing. And of course, like I had no idea that so many studies are being done on it. So when you go to something like this and you see like, wow, like there are a lot of people doing research, and, you know, it may feel like, you know, nobody's making any progress on it, but you know, it's out there, and there are a lot of studies that we can even get involved in too.
And like,
and not even just doctors, but also look at the pharmaceutical companies that are there looking at what different drugs that they can do in their part in helping.
I think, I can't remember who said it, but I think someone who presented talked about how the doctors who were presenting and doing studies were not gatekeeping information, which can often happen. They were all very ready and willing to share what they had so that other people could improve their studies, and it could kind of all, you know, go around and be helpful for everyone.
Yeah, then like go ahead. The networking is amazing, right? And it doesn't matter if you're a doctor, a patient, a scientist, like everybody networked with everybody, right? And the one thing that I do love too, like they got a chance to ask questions after a presentation. So when, as a patient, when you're sitting there and you're thinking like, oh my gosh, it's getting intense. Are they rebuttaling? It's no, I never thought about this, or did you think about this? And I love the way they responded to it, because then they thought, and that was like, okay, go back to the drawing board, or, oh, I never looked at it that way. So it's like, it's almost like watching a whole bunch of doctors in the one room conversing, and everybody's light bulbs are going off. I say, let's go back and try this. And that's how I felt, honestly, taking notes and sitting there, and like all these ideas start popping. I'm like, okay, I gotta go home and process this information. You know what I mean? So it was nice.
I'll be processing for a while. Most definitely. I think for me, it almost felt overwhelming at first because there was so much, but that very quickly just changed to hopeful. Like, I can't imagine if this much research was being done 10 years ago, what the state of care would be now. Does that kind of make sense?
Yeah.
It just, there's so many people working so hard. Like you said, it's amazing. It literally fills me with hope. It's so cool.
One of the things they did talk about, I think it was Dr. Chris Sayed presented on, you know, drugs in the pipeline that were coming up for HS patients. We had some people ask us about this. One person asked us about this before the podcast, and what looks most promising, what they've talked about is, I think it's called secukinumab, and the brand name is Cosentyx. I think it's a Novartis biologic, and they say that it looks like it's performing at least as well as adalimumab, and it should be available in the US in the next 6 to 9 months. I don't know what that means for Canada. Probably like at least like another 6 months longer. I have no idea how the approval system works here, but it should be coming Canada's way at some point after it's approved in the US.
I think in Canada, it is kind of used as kind of like how Humira started, where like an off-label, like most of the drugs are. Because when I recently went to my dermatologist, I actually requested Cosentyx over the Humira, and they're like, whoa, first you got to do Humira, but then if that doesn't work, then we could possibly try Cosentyx.
I think that's in stage 4 of the trials or something right now, or at least it was when they talked about it at the symposium. And then the other one was, I think, I want to say it's called like bimekizumab or something, but the brand name is Bimzelx. And that one is in phase 3 and it's got full enrollment. So that's pushing along as well, and may or may not be approved for treatment of HS.
And in testing, there are 4 phases total?
I think so. That's what they've said every time we've heard about it. I think I'm not really too sure what goes into these processes. I know that they look at, patients on placebo versus patients on, fraction of the drug versus the whole drug, and they kind of build their stats around that.
Mm-hmm.
But yeah, I am not the person you want to ask for extreme detail on it. I understand just the basics. So
yeah, just enough to spark everybody's interest. But yes.
They also, I feel like the first day, the Saturday rather, was really science heavy. And they talked a lot about, inflammatory markers and, which drugs, I guess suppress which inflammatory markers. And that was just, over my head totally.
Yeah, I was dreaming of aisles.
Yeah. Aisle 17, aisle 23.
I had cytokine stuck in my head. I was expecting them to come out at all time.
Yeah, someone's going to say cytokine storm. That's like the thing we hear about a lot.
Mm-hmm. As much as I enjoyed the symposium, I found like, when people like ask me like, oh, did you enjoy your trip? And did you go to the beach? And I don't think they realize like we're going from morning until night.
Yeah.
And like, when we do get the breaks, for us, we're lucky enough to have a booth and, connect with other people. But that booth visiting and poster visiting downtime that people to get, because we have our own tables, we didn't get that time, which comes with, the territory of being a part of it. But, because of the way the time schedule goes, us having HS ourselves have to then be mindful about when to step out and take a break, right? Because we think about, oh my God, if I don't go and I'm going to miss something, and I can miss something that's really good, because everything is great information, right? But I was kind of feeling bad to, take a break, but I have to realize like I came home, and although I was happy and glowing in my heart, and I was like, oh my God, we had so much fun, and it's so amazing coming with ideas, I also came home with like 4 flares, right?
I flared too.
I crashed, right? So, and it's so funny enough, because I remember that morning, or maybe that night, I think we were talking about flares and our buttocks area, and I'm like, oh, I haven't gotten one there yet. And lo and behold, as soon as I got home the next day, I woke up, I'm like, wait, what is that? And it's in a place where I never had it, so like, you get mad at yourself, because like, yeah, well, you didn't.
So much sitting too, like it's sitting
right
in the conference, it's sitting waiting for the plane, it's sitting on the plane, it's
right
so much sitting.
Right. So I don't know, maybe going through this experience now, going back in person for next year, we now know like, no, take your breaks, right?
I think we know to take the breaks during the super sciencey stuff.
Right.
Yeah.
Right. Right.
So they're talking about IELTS again. Let's take a break. We don't understand.
Yeah. Exactly. So yeah, I think now we'll be more prepared for next year. Do you know what I mean?
Mm-hmm.
Mm-hmm. And I appreciate the fact that they know already when and where it's gonna happen and the dates.
Mm-hmm.
So that we're not prolonging and waiting. So it gives us more time to prepare if we do attend next year. So yeah.
I can't remember the exact dates of it next year, but it's going to be in Phoenix, Arizona. And did you guys all get
13, 14, 15, I believe.
Yeah, that's it.
Did you guys get the survey after? And they're like, where do you want it to be? I'm like, in the north.
Yeah, I said that
in the Northwest.
Yeah.
We're cold, like not cold, but fall temperatures.
Yeah.
You know what I would like to see though, because before the pandemic, they were supposed to come and do it in Montreal, and I was excited for that. So if they could just come back to that would be amazing.
You know what? I had asked Dr. George about that. We were talking before the podcast started that Michael and I had run into Dr. George at the airport, and we got to talking, and we had asked why it wasn't going to be in Canada next year. And he said, because they get better attendance and the population is just so much bigger in the States, it's probably going to be an 80-20.
Right.
It'll be 3 or 4 years in the States and then 1 year in Canada.
Right. That's understood.
Yeah, it makes sense. You want to get as much people out as possible. So yeah. Totally understandable.
I think it would be nice if they could find a way to do a like live virtual component, because I think they said they had so much patient participation in 2021. I want to say they had like 79 patients or upwards, but this time it was kind of just, the patient groups. There weren't just patients there per se.
Yeah, and then that virtual one they did in 2021, there was like a lot more events for just the patients, I noticed. So at this time they didn't really have anything that was just for patients. I guess because like you said, it was just mostly patient groups, like advocacy groups that came out, but I thought that was really fun. So if they could include that in future ones, that'd be cool.
Yeah, I thought they were good too.
Yeah.
But I
Like
think
when we were in Detroit, when we met Stephanie, they had like the patient group where patients came in and they talked about how they're feeling, and guardians came in and talked about what they're going through, and they shared like they had topics about like pain management stuff, and patients were just talking about what they're going through and what they're taking, and it was so funny. And then some of the doctors sat in the background and just was just gathering information about what the patients were saying, and that was really nice. So I missed that component of the symposium.
So that was Hope for HS. That was their regularly hosted support group that they do, and they always have a doctor at the support group to kind of give information when needed. So I think Dr. Hamzavi had sat in on that one, and it was really nice. And there were a lot of patients there who maybe weren't going to the symposium, but were just there for the support aspect, and it was really, really nice.
Right.
I think too, though, the part about patients is it's kind of expensive. Like the ticket is not that expensive, but it's the flying and then the hotel. And then like they had the bingo to win. Here I am getting all the stamps, and then they still gave it to a doctor. And I'm like, oh, come on, doctor, can't your workplace pay for you to come? Like, so maybe if they can do some sort of sponsorship for patients or find a way to have that part be virtual. So then that way they incorporate it more like with patients, and then that way too, maybe then they'll start to realize like, hey, we do have some patients coming out. Maybe we should kind of break it up and at least let people know like, okay, this is science heavy patients. You may not want to come, just so we can schedule our day and not be like, hey, I need to go to the bathroom. I need to eat, but there's a session and then the booth right after. So yeah.
You know what they didn't do this year that didn't occur to me until like just now, that in 2019 they had patient speakers who spoke about their experience with HS, and they didn't have any this year.
Right.
Oh, that would have been really cool.
Because I remember
they did that was amazing.
Yeah, I remember there were like two minimum. There might have been more, but there was for sure two. And then I think there was like a mom who spoke to her experience navigating the American healthcare system for her daughter. There was a lot of patient caregiver focus in 2019 that there really wasn't much of this year.
Yeah, I think they should have that added in every year, because that was quite effective. Like it was awesome.
That sounds like it would help a lot with like just the compassion that a lot of not doctors at the symposium, but a lot of doctors elsewhere are missing. But yeah, I think that these doctors, they understand that the patients are in so much pain. So
Agreed. On the last day, they did a couple of presentations that had to do with lifestyle. One of them was diet. I think that the study came out of the Netherlands, but don't quote me on that. It came from somewhere in Europe with a mostly white population. And they talked about how people in stage 1 were kind of able to manage their disease with a very strict dietary plan. And it was kind of, pretty robust in how many patients were included. But the issue is that, the Canadian landscape does not look like this European landscape. Like not everybody, is financially able to eat in this healthy lifestyle. Not everybody has access to grocery stores. There's just a lot of different, economic factors here that doesn't make it fully possible. They also, I don't think, took into full account disease severity, because when you're if you're in like a very severe stage of HS, you're not trying to make a full healthy meal that takes you an hour to stand in the kitchen and cook. You're going to grab something fast and something easy because you physically are not capable. So I think that it was geared more towards like the early mild stages of HS, but it certainly doesn't seem like diet would be a number one factor for severe HS patients.
Right.
And they also talked about HS treatment and surgery. I think that was on the Saturday. Or specifically biologics in surgery, and how with good clinical treatment of HS, the surgery really can step up your care to another level to help manage the HS. And they have found that best outcomes use a combination of the two in terms of management.
I feel like they touched on that though already in previous years, because that's kind of how I had my own treatment plan, was from previous years. So I was a little shocked to be like, okay, didn't we
they kind of repeat it. I feel like they're just trying to like drill it into the newbies. Like it needs to all work together.
Yeah.
One thing that was new to me, I might not be new to everybody else, but there was one on biofilm, and they had some sort of like anti-biofilm gel or something that would be used for some sort of treatment. That seemed to, it was a study that they did, and that seemed to help people. I think they came back on like 2 visits, and it just kept getting better and better as in recovery. So that was interesting to me. I would want to try that.
I think that's the Blastex that they put right into the tunnel.
Yeah, exactly.
Which is the thing that the table beside us gave to me. But I obviously am not going to be like, okay, inject into my tunnel.
Yeah.
No, I think a doctor needs to do that.
One of the things that stood out to me too is when they talked about, I'm sorry, Mike, but they talked about birth control in HS. That was really big too, because you start to ponder like, oh, well, that's why I was flaring so much. Mind you, like when I was younger, I had issues with birth control, and at that time they didn't diagnose me with HS, but they knew that the birth control was affecting it, and the hormone replacement and that kind of stuff. So now that we have this study, like you can go into the doctor's office with an informative information and be like, okay, let's sit down and make a proper plan. Because even the struggle for myself is like, you can't go on every and anything. I know weight triggers my HS. Birth controls make your HS, birth control can make you add on the weight. You know what I mean? So I can't take that birth control. So, we'll take the Depo-Vera. Well, I know that, you know what I mean? So it opened up my eyes, but also at the same time kind of felt like as females, you're kind of limited as to what you can take.
There's also, sorry to just jump in, but there's also drugs that can treat HS that you can't take unless you're on a birth control as a female. So like spironolactone, Accutane, I think methotrexate. There's things like that you cannot take unless you're on birth control. And just to speak to Latoya's point, the study was kind of the difference between a progesterone-based birth control and then an estrogen progesterone-based birth control, so a combination birth control. And I remember Latoya and I having a whispered conversation during it about the progesterone-based birth control, because when I was on progesterone-based birth control, I never flared worse. I was flaring like crazy, and I was just on a pill form of it. And then my endocrinologist, tried to give me a progesterone-based IUD. And I happened to read it before I booked my appointment and saw that it said progesterone on it. And I was like, no. Like, this is not for me. This is going to make me flare. But yeah, it's people just, don't know. Like my endocrinologist didn't know.
But we're educated. So now we could go in with a plan. So, it helps going and learning or getting the information about this and them doing these kind of studies. It helps, right? Because the last thing you want to do is trigger your own HS out of lack of knowledge, basically, right? I know having HS is trial and error, but like, taking a birth control that has progesterone, hormone, if we knew, we wouldn't put ourselves in predicament to take that form. At least it gives us a voice now to advocate for ourselves. Be a part of your medical team. your medical treatment. You have a doctor, you have, your surgeon and your family doctor, whosoever, but they can't make the plan without you, right? So learning the knowledge, and even if you're not able to go to symposium, but then you see groups like HS Heroes that bring the information back, or, I hope for HS or whosoever do a recap like this, very much say they now know, okay, let me look into this a little bit more to be that advocate for themselves. So I believe all of this is a beautiful thing. Having the recap is a beautiful thing. Going to symposium is a beautiful thing. Connecting with other HS warriors is a beautiful thing. So, it's just great all around.
Yeah, an informed patient is a good patient, and hopefully you get lucky with a doctor who's collaborative. It doesn't mean combative. It just means like if you're able to help make educated treatment decisions for yourself and your body.
I think that's a good lead into probably my favorite presentation, which is on the last day. It was by, I'm probably going to say her name wrong and I apologize, but I'm going to try with Davia D, who was a MD candidate at the Jacobs School of Medicine in Buffalo. And she basically had sent out a survey to educate HS patients with pictures about, this is stage 1, this is stage 2, this is stage 3, trying to build an education and gain and help patients sort of gain a self-confidence in both self-reporting and stuff. And she found, like, wholeheartedly, with a simple 9 pictures and a little bit of education, there was I don't see it right now in my notes, but there was a huge percentage improvement of education in a really simple amount of time. And I think that goes to show, again, education is power.
Yeah, I saw the slides on that, and I thought, even for me, I'm not really comfortable in telling the difference between stage 2 and 3. To me, they kind of look very similar. So, yeah, I think doing studies like that, where you're educating patients on how to be able to tell what stage they're in, so that they can report, is helpful. So, I would like to take a little lesson on that myself.
Yeah, I'd certainly get a brush up, because looking at those pictures, I think I could be confusing 1 and 2.
You know what, too, that really stood out? At our table, we had a lot of pediatricians coming to our table and asking for support groups and stuff. And it just, even here in the GTA, hearing other doctors talk about it, and more the pediatrician doctors. And when you hear pediatrician, you think of little kids, right? Mm-hmm. Underneath the age of 18, but more so the smaller ones, for me, 10 and under. And so 8 or 12 and under. And then it just makes me feel wow. They say when puberty hits, and that's teenage or preteen, but it's starting now before that, 8, 9 years old. And when we meet other warriors and they say, oh, they've had it at 8, 9 years old, that's a handful of people. But then now, in this day and time, it's happening so often. And so I just hope and wish, and I'm actually grateful to know that there is so much pediatricians inside the room to learn about it, so that maybe if they know about it, then the kids don't have to go through what we went through, waiting 7, 8 years, and treatments can start early. But it was a bittersweet for me, because it was yes, maybe there'll be, early diagnosis, but then sad, because we know what we went through with our HS and continue to go through. How does a child go through it? Do you know what I mean? So that's something that really stood out.
Yeah, and the hope is that it gets caught early too.
Uh-huh.
So then they can, stay in the low stage. When I was in stage 1 of HS, I was like, this is the worst. No one has this worse than I do. And then I met other patients who had advanced stage HS, and I was like, it really gave me, a perspective check on what my HS was doing, because it felt like I was alone in the world. And it was awful, even though it was stage 1, which now seems so minor to me. But when you're in stage 1 for the first time and just starting to get these things, it feels like the end of the world. It feels like it takes up your entire thought process and your world centers around it. And that's a hard thing, especially for young kids and teenagers who are already, struggling with, changes in their lives, dealing with high school hormones, puberty. It's just, it's an awful time to have this happen.
And I
And social
think
media,
too,
right?
with stage one, like I'm kind of stage one, a little bit stage two, but you also have to make sure to manage it so you don't become stage three. So I have a lot of people being like, well, it's not even that bad, but it's like, if I'm not on medication, it's probably going to progress much faster.
Mhm.
And two, for children, they have the bullying aspect of being in school. And yeah,
Mhm.
I couldn't imagine.
And bullying's like never been worse because like internet bullying didn't exist when we were kids.
Oh,
Right.
thank God.
And now the whole
Right.
thing takes place online.
Yeah, it does. And it's like, if we as adults are going through the depression that we're going through and the anxiety that was going through, like I literally used to walk around with my hand like this in a mall, right? Not realizing I'm putting my hand up to protect myself from anybody bumping into me. Because if one little nudge is going to send me in excruciating pain, yeah? So, like, if I was going through that, and I was going through that in my 20s, how does a 8, 9, 10-year-old kid, go through that? And yes, okay, there's youth too that are going through that, but their bodies are not even developed yet, much less their brain. So can you imagine their whole entire world is upside down? And then for parents probably thinking like, what did I do to my kid? So it it's it's a rough thing to think about. But then, like I said, pediatricians coming out and learning more about it. I'm glad. Like people's eyes and ears are opening and realizing that this is a big problem. Being misdiagnosed for 7 years before you can get an diagnosis is a big, big problem. Like if we can cut down on that, I think a lot of us would be in a better place with treatment.
The one thing I really liked that really stood out to me was the models of HS care, where you had a lot of the top doctors that have been practicing HS for a long time. And the one thing that really stood out was when they said, when you get a patient referred to you, pick up the phone and call that doctor. To think of
Mm,
how many doctors we see where they don't even talk to one another. It's just boom, okay, there you go. So it's nice to see, or even how they said, like, okay, you have a whole checklist, but you won't have time in every single appointment. So I love how they're kind of showing everyone from their practice what they found works best for them. And I think majority of them were surgeons as well. They weren't even dermatologists. Just on the dermatology part, they were surgeons.
I wonder if the doctors have like a running list of who, like for us in the GTA, we know of a couple doctors, but I wonder if them themselves have a running list of which dermatologist or which doctor or which surgeon specializes in HS so that they're not scrambling and saying, I don't know. Do you know what I mean?
I don't think that they do.
Mhm.
My one of my friends, at the beginning of the year, sent me some pictures and said, what does this look like to you? It was of the side of her breast, and I was like, I'm really, really sorry that I'm about to say this to you, but it looks like HS to me, and I think you need to see my derm. So I made her get a referral to York Dermatology from her doctor, but it was going to take a little bit of time to get her in. So she thought, maybe in the interim, I'll go and see this other derm and just see if I can get some help in between. And this
Mhm.
doctor looked at, they weren't even opening on her breast. They were just, how they become like big red circles.
Mhm.
So it was kind of that at that point. And he looked at them and then had to pull out a book. And then he looked through like a medical textbook and was like, okay, it could be furuncles, carbuncles, or HS, but there's no treatment. So you're going to have to just deal with it.
And this was a derm?
This was a derm.
Mhm.
Wow.
Like a girl that I know, she discovered that she has HS through me having HS and starting up the organization. And she says, I think my sister has it. And so she's looking and she's like, no, we're gonna go and get a referral and so and so and so. And they saw a pediatrician referral and they're like, no, you're too young to have HS. She was
How old is
12.
she?
She was 12. Told her she
Yeah.
was too young. So the lack of knowledge is dangerous, man.
I remember when I I guess not when I first got diagnosed, but a couple of years after my diagnosis, I kind of learned a little bit about HS and I knew what it was about. I was in an emergency room and one of the emergency room doctors said, "Oh, you have HS, that's just a side effect of medication."
Mm-mm.
I was like, I'm just gonna go. I'm gonna go. I was on my way out when he said it to me and I'm like, okay, bye.
Mhm.
I feel like any doctors that potentially go to like U of T because you have that K, whatever that guy is, I feel like they kind of touch on HS. And actually, funny enough, my first dermatologist that I just got lucked out, who I got referred to, who diagnosed me, started me on, antibiotics and then switched to different antibiotics and switched to other. So when I had seen Dr. Al Hussein, he's like, "Oh, you saw Dr. Papnesia? She actually studied at U of T. Like either they studied together or he had taught her," which I found like, wow, out of the luck of the draw I were to get, I went to the one who like knows HS.
That's
Mhm.
really, really
Yeah, that's
lucky.
really good. Yeah.
To be honest with you, I did not have a dermatologist. I didn't have a dermatologist until a year ago, Dr. Shikini. Do you know who was following me? My plastic surgeon. I was referred. I was going to get like one of my flares drained, and then a nurse says, "Hey, I think I know a doctor who knows something about this." And she said, "Ask for this referral for Dr. Laura Tate." I said, "Okay." My family doctor, she's pretty good. She's like, "Okay, let's try anything and everything." And so she gave me the referral, and lo and behold, Dr. Laura Tate's like, "Yeah, this is what it is. We got to do surgery." So Dr. Laura Tate was the only one that was controlling my HS in the sense of antibiotics and surgery. Never ever had a dermatologist, one in a couple here and there, but then you got like, what is that, or so and so, and I wasn't happy with it. But it's not until literally a year, like going on 2 years now, since I've actually had a proper dermatologist. Because at that time back in the day because I got it when I was 17, I'm 37 now, but they didn't know what it was, and so they wanted to like guinea pig. You want to do this study? Can I do so? Can I cut you? Can I do this? I was like, yeah, no. Do you know what I mean? So yeah, I find it quite amazing to know they came a long way. It came from either one doctor to now a whole team of doctors who's supposed to be on your medical team. So yeah.
I remember Latoya. Am I muted? No. I remember Latoya when I first met you, you had a lot of kind of mistrust in the
Mhm.
medical community. Do you feel differently now that you have a care team who understands your disease?
To be honest with you, I trust my team. But when I don't trust going into the emergency because I
Mm,
always have to educate somebody on it. I don't mind educating the triage nurses about it, but like still there's doctors who don't have any bedside manners about it. Mind you, they heard of it more. Like HS, okay, cool. But there's still doctors who have no bedside manners that does not make you feel good going in there. It's like it gives you a flashback or re-traumatizes you when it was not known, right? Instead of saying blatantly, "I'm not sure," you come and give me a bunch of pills for something that you don't know, or you're refusing to treat me, or you tell me that, "Oh, it's because you're too heavy," and it's like, oh, going through this all over again. Like it's medical trauma all over again. And it wasn't until that we were in the symposium where I understood the term medical trauma, right? I didn't see we went through what we went through, but never really said what it was, right? And so learning what we've experienced and the mistrust from the doctors and the myths and that kind of stuff. No, there's a word to it, medical trauma, and it's real. It's so real. It's real to the point where it's like I struggle to take my meds. I struggle to take. If Dr. Chikini gives me another pill to take, I struggle with it, and I can't put my finger on it as why I struggle with taking my meds. But then when you sit there and I sat there and really analyzed it. Every time I took medication when they did not know what it was, it made me more worse than better. So now when I'm actually getting the proper treatment now, it's like, no, but I remember when that made my stomach hurt and I was throwing up all over the place. So no, right? So yeah, you're right. Medical trauma and the trust is a big thing for HS patients.
I for me, it's not taking pills. It's gonna almost sound a little bit silly, but it's the smell or taste of Jello. I was in the hospital for a long time in 2012. I was in for almost 3 months, and I wasn't eating anything because the HS had the HS. So just a little backstory: the HS had been right next to my rectum, and instead of kind of opening out, it opened in, and then infection happened, and a lot of tissue got destroyed, and I ended up with an ileostomy. So the ileostomy retracted, which means that, like, if my skin is flat and this is the ostomy, my skin pulled away. So there was kind of like a moat of like non-tissue between my ostomy and my skin. And the waste was just causing, tissue to erode. It was so painful. So I wasn't eating any solid food, and they would give me Jello morning, afternoon, night, whenever. And I was kind of being forced to eat it because there was no other nourishment happening. So now for me, because of my HS and how it put me in the hospital and the complications I had, Jello is a huge trigger for me.
Yeah, for me, I just feel like I was like passed around so much. Like I would go to one doctor and, sometimes their response or their reaction to me or what I had would be like not really pleasant. And I'd just be referred to someone else and then just referred to someone else, referred to someone else. I called it, I'm being passed around like a hot potato. Like there's no one wants to deal with me. No one, like, they just see me and like, I'm not dealing with this and just pass it over. So yeah, I like hated doctors for a long time. And like your question now, like, do you still have mistrust? Like I still do. Like if I'm going to see a new doctor, I have anxiety about that because their responses to me have not been very pleasant. So,
I
Yeah.
when I have to go to the emergency room, I try to go to Mount Sinai downtown because that's where the majority of my specialists are. And I send an email when I get there and say, I'm in the emergency room, just wanted you to know. And more often than not, one of my specialists will be like, okay, I got you. And they'll call down to the emergency room and say, you need to run these tests. Like, don't even bother with these ones. So I get much better care when I go to the hospital where my specialists are. It's the team that I trust. Is the team that I, go to when things go sideways. And I just feel so lucky that they've, had my back since day one. When I got to them, it was bad before, but now that I got to them, I'm so well taken care of.
I'm kind of the same, not even for HS for me, but I've got, for backstory, I have something called Safo syndrome, which is a rare form of arthritis. And it took me forever to get a diagnosis. I was passed around like a hot potato. That's kind of a good quote in Ottawa. And a lot of doctors seem to take me asking for help as give me pain medication. And they would never hear the difference. And, they saw the long-haired artist who was the theater student and not somebody who was losing their life. Like my teeth were dropping out. And, it's like, oh no, he's a drug addict. So yeah, and it wasn't until I got to where I am now, Peterborough, and I met my current GP that I actually felt listened to, and yeah, no, and he literally, I feel like he changed my life, and like you now, my team now is amazing. If my dermatologist moved cities, I would probably follow.
When Dr. Alavi left for the Mayo Clinic, I cried. So sad. She was like, when she was with me from that time when I was in the hospital until 2019, 2020, and she like saved my life. She helped me get from where I was to where I am today. And I've been so well managed for so long with the same kind of regimen that I was on when I was with her. And we saw her at the symposium, and it was so nice. I remember I got in there and all I heard was Stephanie, and I turned around and it was Dr. Alavi, and I'm so happy. I really like Dr. Cicchini too, but I feel like Dr. Alavi is just like a different love. She was with me for so long, and I feel like I am where I am today because of her.
Mm-hmm.
And
I
I just
agree.
remember she met me years ago at Toronto College Hospital. I had forgotten I had met her. And she like, boom, I met you like 5 years ago in Toronto. And it's like, whoa, lady.
Yeah, you're hard
You
to
are very
forget, Mike.
memorable.
I guess
Mhm.
Hector doesn't get to many medical conferences. I don't know. But
So
no, she does seem awesome.
she is awesome. And she's doing like great things at the Mayo Clinic. But now that we're back on the topic of the symposium, is there anything you guys wish that they would present on or that people would do studies for? I kind of, sorry, I'm just going to jump in and answer my own question. I would like to see more information on psoriasis and HS because they have, psoriatic arthritis. I wonder if there's, arthritis that's specifically tied to HS because like I feel it like in my hips and my hands. But I would like to know, and I know arthritis is a comorbidity, but I'd like to know if there's maybe a more specific link than just being a comorbidity.
Mm.
Well,
For
I mean,
me-
there is, yeah, to some extent, because mine is SAPHO with associated hidradenitis. But I mean, SAPHO is so rare, but there's so many people with HS that have some form of joint pain and arthritis. Yeah, I agree. That would be a really interesting study.
Mhm.
So somebody mentioned there a study, and I forget what it was, but it was a question about pregnancy and sex of baby.
Oh, that was me.
Oh, was that you? I just remember thinking that would be a really cool question, but I don't, what was it?
I was always curious as to, if HS flared more when you were pregnant with a male fetus than a female because the testosterone.
Oh, that would make sense because I flared bad when I was pregnant. I think that was one of my my go take a pregnancy test kind of thing, right? I was expecting, mind you, prior to that, the doctors did tell me that I wasn't going to be able to have children. So I didn't take it as anything. But then, I was like, why am I flaring so much? Flare and flare and flare. It was quite ridiculous. And somebody said, go take a pregnancy test. And I wasn't intended to take none. I was like, okay, and it was being sporadic again. So, because at that time too, PCOS and your period's never really regular. And I said, oh, and I took it in there. I was pregnant. It was bad. Like I was on IV treatment, ceftriaxone, 1 gram every 24 hours for like 10 days. And so when I got the treatment before I took the pregnancy test. So I was on the medication. And then when I found I was pregnant, I started freaking out. I'm like, oh my God, is the med's going to hurt the baby? You know what I mean? But my HS was really bad. And then it kind of calmed down, after I delivered. But then literally like 3 weeks after I had her, it came back with a vengeance. It's like, because pregnancy changes your body, right? Hormones, right? But then after you have your baby, you may look the same on the outside, but internally your body's changed, right? And so I had a hard time after delivery with my HS. Like it turned for the worse. And mind you, everybody's experience is different. Some people are better, do you know what I mean? But I think also mine had turned for the worse because I'm also Rh negative. So my body thought that my baby was an infection. So really and truly, I think my HS really spurred out of control for those two reasons, right?
One thing
Yeah.
I kind of wanted to see studied a little bit more is kind of maybe the side effects of biologics or how to combat the fear a lot of us patients have, because I know that's something that I would be interested in, because it's easy for them to be like, okay, Humira and then a different biologic and it's all injections, but I don't know if they really think like that's a big fear for us. And the side effects aren't just like diarrhea, nausea, it's like cancer, psoriasis, so a little bit more scary.
For me, I think there was a presentation on the genetic relation to HS. I don't really remember much of it, so it was probably like too scientific. It kind of went over my head, but I would be interested to know like how likely it is to pass it on to your children. Like that's something that I think about a lot like if I have a child, like will they have to deal with this and what kind of treatments will be available by then? So yeah, I would want to know that.
That one was super interesting. I can't remember exact numbers, but I feel like they were a little bit lower than what had kind of been the popular number, which they were like usually they say 30% of patients report a family history, but I think the number in the study ended up being a lot lower than that.
And when we met at the symposium in Detroit, it was like at that time it was like 1 in every 3 HS patients was hereditary, right? So and they struggled to find out how, because some people we met and it's generation after generation. But then like my family, I have it, my 2 middle sisters doesn't have it, and my last sister have it, but then nobody else that we know have it, right? And then there's some people where there's only one person who has it, but then the great, 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 great grandma has it. So I think that's where they're struggling to figure out like how or if we, is my child gonna get it? Like, and this is why I'm kind of hesitant also onto having a next one, right? Because you don't want to wish this on your worst enemy. And when I had told that to my doctor, she's like, well, the beauty of it is that you know what it is. So she'll get diagnosed faster. So it's like right now, because they don't know, it's 50% chance that they would get it, 50% chance that they would not get it. You don't know. So
I was gonna say, I wonder if, there's more people recognizing and diagnosing HS now, and that's why the number is different because, 10 years ago, if you knew you had HS and you saw signs in your kid, you would take them in and then there you go, that's the family connection. But maybe now that people are, know what it is a little bit more, maybe that's why the numbers are changing.
mhm.
What about you, Michael? Any, thoughts on upcoming studies you wish they would do?
Honestly, you nailed it with the arthritis. Which also, well, actually, no. Typical me, maybe. There was some discussion about marijuana for pain relief. I would like to see a lot more studies on that. Kind of narrow down like CBD to THC ratios. Try to get like literally as scientific as possible. And like even narrow it down to like types of weed and like I think there could be a lot of research there. I know with rules and laws in the States that it's kind of hard to do research on that, but I think that could be a huge field. That would be a dream for me to see more on that.
I feel like part of the issue too is that it's like readily available here in Canada for purchase at just like,
Yeah.
like the corner of your street, basically. There's so many like cannabis stores here that they're just not doing the studies because it's available to everybody.
True. Well, I live in downtown Peterborough and I can literally, there's 4 within walking distance of me. Like it's silliness.
And
But
was
the issue I find with that though is that you can't go for medical advice.
no,
Like
you
the second
can't.
you're like, oh, for
That
this,
is
they're
the
like, sorry,
issue.
we can't. Like, I'm
Yeah.
looking for a topical
Yeah.
that has no extra chemicals. And it's like, nowhere's going to have what I need unless I get prescribed it medically, which
Exactly.
most doctors, because it's recreational, it's like, you don't need to get it medically. You can just go down the street.
That's
Well,
the
that's
issue.
you got to go to a clinic. I think we've talked about this, but like I went to a clinic where there is an actual doctor who will like tell me, you need to try this, don't try this, don't try this. There are actual physical doctors that will.
Do you have to pay for it?
I never paid for the one I went to. There are some that you have to. I never.
I
paid
to me, I don't.
for the one that
If
I
you have
did.
to pay for it, to me, it feels a little sketch. Like, why can't my doctor sign off?
No.
And
I agree. The one I went to, it was an OHIP card. Now,
and did your doctor need to do anything?
My doctor sent me, like he referred me. That's the word I was looking for.
Yeah,
but
not many doctors would now that it's so legal.
I mean, you don't know until you ask, and because it's legal, I'm not sure you need that requisition anymore either. Because I'm talking years ago.
True.
Because it was still very illegal, man. When I got that, I showed it to everybody. I was trapped.
It would certainly be nice if they could, have like an accurate dosing system, say a pill for pain management, where you know exactly what you're taking, how much of it you're taking, and they dose it out like they would, a pain medication, except it's not, as harmful or as inflammatory.
That's a dream. That's an absolute dream.
Yeah, that makes sense. Yeah.
Because that's it. And now as much as you can dose, every strain is different. It's going to affect people differently. You got to get, the Alana stream would be like a basic dose every time, the same that you can dose out. Yeah, work. But sorry, that was my tangent. I'll be quiet now.
I would also, sorry, just for my situation, I have vasculitis. It's called Wegener's granulomatosis, or granulomatosis with polyangiitis, and it kind of is localized to my lungs and causes blood vessel inflammation in parts of my lungs to die. So I can't do things like smoking or anything like that. So if there was a pain medication option, a more natural pain medication option that I could take as a pill form rather than, smoking, that would be kind of ideal, because in the past I've had severe, pain medication withdrawal after leaving hospitals and being on personal pain pumps. And it was almost scarier than anything else I went through. I never thought I was going to die from the complications of HS. I thought I was going to die when I went through narcotic withdrawal after leaving the hospital.
Oh, wow.
I mean,
I'm on the pharmacy. I know.
Helpful after surgeries, but man, if you're not well looked after or monitored, that can go sideways real fast.
I believe you, because when I did one of my surgeries and I needed a skin graft done, and back in the days, the studies are not there. It's almost like because you have 3 layers of skin. So when they do a skin graft, they take off your first layer of skin, and they had to take off the layer from my bum and put it in my armpit. Mind you, they did the surgeries 2 weeks apart, because when they did my right axilla, they took everything out, not a piece, every living thing. It's like I had no armpit. And so they said that was the biggest HS surgery they had. So I stayed in the hospital for 2 weeks straight. The first week, it was there, and they used the vac to try to close it. And once the vac got a little bit smaller, then they gave me the skin graft and took the skin from my bum and put it on my armpit. When they woke me up from the skin graft surgery, it hurt worse than the actual HS surgery. And I was crying so much. When you go out, when you have surgery and they take you into recovery, so you're kind of, and you're just opening up your eyes because they're like, wake up, so and so. I woke up crying, put me back to sleep, because the pain was so much. And then when I woke up, I was high out of my mind. High. I'm crying and didn't realize I was crying until I connected my face with my hand. I'm like, I'm crying. And seeing dogs and stuff like that jumping over. It was so ridiculous. But then all I wanted was that pain med. All those, whatever they gave me, whatever they injected, that's all I wanted, because I spent another week in the hospital. I'm like, no, I need to sleep. This pain is too much. So I believe you, Stephanie, when they say withdraw from the pain meds. It's scary. It works, but then it's you don't know your head from your feet when you're that high off of the meds. And we're not junkies. The pain is that severe, and I don't think they believe us when we say it's that severe. It's crazy.
When I was in, I have two questions. One about the skin graft.
Yes.
What causes that pain? Is it just open nerve endings after removing part of the dermis?
So it was the nerves, yeah. But then second of all, they just put the gauze down on my skin graft and then covered me up. They didn't put Gelinet, because back in the day, they don't know those things. And so when it came to changing my bandage, my flesh was kind of like the what do you call it? The gauze embedded in my flesh that was growing, and they have to change it, so they have to rip it off. So it was bloody murder. It was bloody murder. And then they realized, okay, putting gauze on a fresh, skin graft doesn't work. So then that's when they had put that basically Vaseline at that time. And they covered my whole entire skin graft. then they put on the gauze,
Okay.
and then they put on a thing. So it's like trial and error. And I think honestly, a year later, that's when they developed Gelinet. Or I don't know, maybe that's when the hospital finally got access to it. And then from then on, I've always had it. Right? Because my surgeries were never sewn; they were always open.
Mm-hmm.
So yeah. So yeah.
My second question for you is, do you have full range of motion in your arm?
In the beginning, no. Over time, yes. And for the skin graft, it's still tight, but it's soft. Like over the years, it's softened, but it's still like weird, bumpy. Honestly, it's like it looks like a lizard, a crocodile. And so I noticed that it's starting to soften, but I got lymphedema in that hand because of the way the healing happened. And that's the first surgery where they had to staple me and stitch me because they have to attach your skin graft to somewhere else, right?
Mm.
But yeah, no, range of motion, it took years and years and years of finally being able to lift both of my hands up straight in the air. And then therapy, like I had to do massage therapy for the skin graft too, right? But yeah.
Interesting.
Mm-hmm.
I was just asking because I did an armpit deroofing, nothing as extreme as what you've just explained, but they it was like before they knew they should leave wounds open.
Mm-hmm.
So they had stitched me closed, but I remember one of the instructions was like, make sure you are lifting your arms for like periods of the day because you don't want it to heal and have limited range of motion. So even with like fully stitched up both armpits, I was like in my house, just like with my arms in the air, trying to make sure I wasn't going to get stuck at this level, you know?
Yeah, my arm was in a sling. It was in a sling most of the time, but every time I go to my appointments, because I saw her weekly, she's like, okay, let's pick it up, move it around, so and so. So, but yeah, I think because I also have keloid skin, so it made it like worse for me, range of motion. But like I said, over the years, it got better. Like I move my hand, no problem. Like, and it doesn't hurt or anything like that. Like,
Dr. Keeling did a presentation on surgery where he talked about packing the wound after with Vaseline to help it heal as well.
Mm-hmm.
Which, so that's interesting between the skin graft and the packing of the deroofings.
Yeah.
But I think we're coming to an end here, everybody. Before we go, do you have any parting words for people who might be watching?
Learn as much as you can, be a voice, and stay strong in what you need. Say what you need, say what you like. Doctors are not going to offer you mental health support right then and there. You have to say, I need it. So even if you don't feel that you need it or you're not sure if you need it, inquire about it so that you can get the resources you need.
I'd say know that you're not alone. And if you have the opportunity to potentially go to the symposium or get access to all the material after, I think it's very beneficial because for patients like me, where I don't necessarily have the best medical team, but based off my knowledge and my research, I got referred to a dermatologist of my choice, and I go there with the options I want, not really asking for their advice, more of like, this is what I want. So I found that to be the best as I'm my own doctor.
I would just say that there's hope for us HS patients. There are a lot of doctors, a lot of researchers, pharmaceutical companies who are working very hard to get us some help. So there is hope. And if you're able to come and see for yourself at the next symposium, then I would encourage you to do that.
And I would say I should have let Siobhan go first because she basically just said what I was about to. But I mean, honestly, yeah, my big takeaway from this is hope. Like there's so much coming down the pipeline. It's really sort of cool to see. Like I'm kind of excited to see treatment options for 5 or 10 years. I have a feeling there are going to be so many more than we currently have. And it's going to be life-changing. It's kind of exciting.
Well, thank you everyone for joining us today, and a very special thank you to the Hidradenitis Me team. Join us next month for another episode of the HS Heroes podcast. And until then, remember, real heroes don't wear capes.